My name is Nicole Christensen. I'm the Director of Ca Answered. We provide patient advocacy and healthcare coordination.
And I'm Marie O'Brien. I'm an integrative pain management nurse practitioner.
Tell me more about that. What does that mean?
Integrative pain management is the use of non-pharmacologic modalities, so things that don't include medication, as well as holistic health interventions such as healthy eating. We utilize a lot of complementary modalities, so many times I'll recommend modalities like acupuncture, acupressure, reflexology, Reiki. I use aromatherapy on a daily basis with my patients in a hospital setting. I will always counsel people on positive behavior, thinking in a positive way. I also use clinical hypnosis for patients who have chronic pain.
That's excellent. I do. I come across a lot of clients that are looking for their different options. People that are struggling with pain and they don't know what else is out there. And that's a question that they have. So it's excellent that more people can learn about the services that you provide.
The first thing that I would want to emphasize is that if anyone were to come to Ca Answered reporting that they had terrible pain and they're looking for help, they always need to be checked out by their primary care doctor so that they know what type of pain or why they're experiencing pain. We would never want to refer a client or a patient to alternative or complementary or integrative modalities just out of the gate without having them get a clearance from their primary care doctor. You know, we were talking a little bit before about some complementary interventions, modalities like yoga, acupuncture, clinical hypnosis, and I think it's a great suggestion for clients that we both see about the use of a flex spending account.
Yeah, that can be very, very useful for people if they have it in their jobs, right? And then they can put it on there and it's tax-free and they, most importantly, they get the relief that they need. So again, we both know there's options available. And so we like to talk at Ca Answered with our clients about the different ways that you can get it done.
And especially when it comes to the end of the year, I know even for myself, sometimes I'm struggling to kind of use up that last $100 in my flex spending account. And I almost forgot this year that I could submit my own receipts from yoga that I go to.
That's really important, and it's a breath of fresh air when you can do it, right?
Yes, absolutely.
So it's definitely one of those things that we bring up with our clients that have the access to flex spending. Yes.
And a wonderful thing, which we were talking about a little earlier today, is that our veterans who go to the VA, they're entitled to acupuncture treatments, and the VA is very pro-integrative modalities.
Yes, I know, and it's a benefit that people don't realize sometimes, even though they have a relationship with their Veterans Hospital or Veterans Affairs. So it's really great that we can inform people. And in that line, I know that you do some educational work for people. Can you tell us a little bit more about that?
Oh, absolutely. So a number of years ago, working in a hospital environment, we were really struggling with finding non-medicine ways to improve a patient's comfort, decrease their anxiety, nausea, and my team was very fortunate to be involved with an educational program in aromatherapy.
Oh, great.
So we utilize, as I said before, aromatherapy on a daily basis with the patients in the hospital. And I've been very fortunate to have gained additional training in aromatherapy, and I now teach outside courses in aromatherapy for providers. So in not too long from now, I'm going to be going out to California and teaching a class in aromatherapy as well as drama therapy.
Now, when you say you do the education, is it only for clinicians and providers, or is it can I go?
Right. So anyone who is interested in aromatherapy could absolutely attend. The really wonderful thing about the course that we will be offering is that we'll be able to provide continuing education credits for nurses, for drama therapists, So we're really seeking to expand the education that we're providing.
That's excellent. That's excellent. So
Thank
more
you.
people will know.
Yes.
And that's really the thing. And so with drama therapy as well, it's something that I feel strongly about as well. So many of the people that I've worked with and clients, they tell me they're trying to find different options, as
Yes.
we've been talking about this whole time. And music and drama therapy, especially for my clients that are struggling with things like dementia or movement disorders,
Yes.
those kinds of things, they really have found the benefit of it. So I'm so excited to talk about and hear about what you're doing there. So tell me more about how people find you when they're in this chronic pain, because as I said before, I've had calls of what do I do now, and scared because they hear about the opioid crisis and they don't want to be part of a statistic, but they definitely want some pain relief. How do people find you?
So integrative pain management is a very unique field. As an integrative clinician in general, our focus is health and wellness, and in improving health and wellness, we ultimately can help with pain. So integrative pain practitioners are available if you were to go to the website Integrative Pain Management, or the American Pain Society. That's a great resource to locate an integrative practitioner.
Excellent.
And integrative practitioners can actually be found in a vast array of places. So many chiropractors practice integrative pain management, acupuncturists, reflexology, massage therapists, but it's very important that when you are seeking out an integrative clinician that you are certain that they have the proper credentials. So in looking at those national organizations to find someone who is competent and confident in their skills. And for those patients who are seeking alternative methods of getting their pain under control, they should feel assured that there definitely are other options other than pain medication. You know, for certain conditions, pain medication may be necessary, someone who has very bad cancer pain, but integrative modalities can absolutely decrease the amount of medication that someone may use.
So important.
And pain is not just that physical sensation. Pain always involves a physical and an emotional component. So if we're able to help patients feel more calm and confident, such as having coordination of care, that can actually decrease their level of anxiety, which can then lead to a decreased amount of pain. The more anxious that someone is, the worse their pain is going to be. So having that support of knowing that someone's available to help them can absolutely decrease the amount of pain that they're having.
Very interesting way to look at it. Thanks so much.
Oh, you are very welcome.
I think it's just amazing. I'm always learning in this field, and it's just so important that people know that there are things out there to help them. And I love talking to you because you're bringing that to light.
Oh,
and
thank you.
The more people know, the better care that they can get.
Oh, well, this has been a wonderful meeting. Thank you so much.
Thank you.